50 Medication Administration Nclex Questions, Nclex Practice Questions. Introduction. Welcome to another Nclex practice session. In this video, you'll answer 50 medication administration questions covering medication safety, dosage calculations, routes, adverse effects, patient teaching, and nursing priorities. Question 1. A nurse is preparing to administer a medication to a client. Which action is most important before giving the medication? A. Ask the client about their favorite medications. B. Verify the client's identity using two identifiers. C. Document the medication before administering it. D. Ask another nurse to administer the medication. Correct answer: B. Verify the client's identity using two identifiers. Rationale: using two client identifiers helps prevent medication errors and ensures the medication is given to the correct person. Strategy: always prioritize medication safety. Before administration, verify the right patient along with the other medication rights. Question 2. A nurse is administering an oral medication to a client. Which finding requires the nurse to hold the medication and assess the client further? A. The client reports mild thirst. B. The client has difficulty swallowing. C. The client asks for water. D. The client is sitting upright. Correct answer: B. The client has difficulty swallowing. Rationale: difficulty swallowing increases the risk of aspiration when oral medications are administered. The nurse should assess the client before proceeding. Strategy: think safety first. If the route creates an immediate risk, stop and assess before administering the medication. Question 3. A nurse receives a medication order that is difficult to read and cannot be clearly interpreted. What should the nurse do? A. Ask another nurse what the order says. B. Administer the medication based on the most likely interpretation. C. Contact the prescribing provider for clarification. D. Leave the medication at the bedside. Correct answer: C. Contact the prescribing provider for clarification. Rationale: an unclear medication order should never be guessed or interpreted independently. Clarification is necessary to prevent a medication error. Strategy: never guess when an order is unclear. Verify the prescription with the appropriate provider before administration. Question 4. Which medication administration practice is correct? A. Leave medications at the client's bedside for later use. B. Crush all tablets before administration. C. Check the medication label against the medication record. D. Prepare medications for several clients at the same time. Correct answer: C. Check the medication label against the medication record. Rationale: comparing the medication label with the medication record helps ensure the correct drug and dose are administered. Medications should be prepared carefully for each individual client. Strategy: medication administration questions often test the prevention of errors. Choose the action that provides the strongest safety check. Question 5. A client says, "This pill looks different from the one I usually take." What should the nurse do first? A. Tell the client that the medication is correct. B. Administer the medication as prescribed. C. Stop and verify the medication order. D. Ask the client to take the medication later. Correct answer: C. Stop and verify the medication order. Rationale: a client questioning a medication should be taken seriously because the medication may have changed or an error may have occurred. The nurse should verify the medication before administering it. Strategy: when there is uncertainty about a medication, pause rather than proceed. Patient safety comes before completing the medication pass. Question 6. A nurse is administering a medication that requires a specific dose based on the client's weight. Which information is essential? A. The client's height only. B. The client's current weight. C. The client's room number. D. The client's marital status. Correct answer: B. The client's current weight. Rationale: weight-based medications require an accurate current weight to calculate the appropriate dose. Using an outdated or incorrect weight can result in medication toxicity or ineffective treatment. Strategy: when you see mg/kg, immediately think about obtaining an accurate weight before calculating the dose. Question 7. A nurse is preparing to administer a medication by the subcutaneous route. Which site is commonly appropriate? A. Abdomen. B. Dorsogluteal muscle. C. Deltoid muscle. D. Ventrogluteal muscle. Correct answer: A. Abdomen. Rationale: the abdomen is a common site for subcutaneous injections, particularly for medications such as insulin and some anticoagulants. Intramuscular sites are not used for subcutaneous injections. Strategy: remember that subcutaneous injections are given into fatty tissue. Common sites include the abdomen and outer upper arm. Question 8. A nurse is administering insulin. Which action is appropriate? A. Shake the insulin vigorously. B. Verify the insulin type and dose carefully. C. Inject insulin into muscle tissue. D. Massage the injection site vigorously afterward. Correct answer: B. Verify the insulin type and dose carefully. Rationale: insulin is a high-alert medication, and administration errors can cause serious hypoglycemia or other complications. The nurse should carefully verify the insulin type and prescribed dose. Strategy: high-alert medications require extra caution. When insulin appears in an Nclex question, focus heavily on safety and glucose monitoring. Question 9. A nurse is administering an enteric-coated tablet. Which action is correct? A. Crush the tablet. B. Dissolve it in water. C. Give it whole. D. Split it in half. Correct answer: C. Give it whole. Rationale: enteric-coated tablets are designed to dissolve in a specific part of the gastrointestinal tract. Crushing or splitting them can alter their intended action. Strategy: watch for medication formulations that should not be altered, including enteric-coated and many extended-release preparations. Question 10. A nurse discovers that a medication error has occurred. What is the nurse's priority action? A. Complete the incident report first. B. Assess the client. C. Notify the client's family. D. Hide the error. Correct answer: B. Assess the client. Rationale: the client's safety is the priority after a medication error. The nurse should immediately assess the client and take appropriate action based on the medication involved. Strategy: for errors, remember assess first. After addressing the client's immediate needs, follow facility policy for reporting and notification. Question 11. A nurse is administering a medication by the intravenous, 4, route. Which assessment is most important before administration? A. Bowel sounds. B. Foresight patency. C. Hearing ability. D. Skin turgor. Correct answer: B. Foresight patency. Rationale: the nurse must ensure the foresight is patent and free from complications before administering N4 medication. Strategy: for 4 medications, always assess the foresight first for patency, redness, swelling, or infiltration. Question 12. A nurse is preparing medications for a client. Which action violates medication safety principles? A. Checking the expiration date. B. Comparing the medication with the MAR. C. Preparing medications for several clients at once. D. Performing hand hygiene. Correct answer: C. Preparing medications for several clients at once. Rationale: preparing medications for multiple clients at the same time increases the risk of medication errors. Medications should be prepared for one client at a time. Strategy: choose the action that reduces distractions and prevents mix-ups. Question 13. A client refuses a prescribed medication. What should the nurse do first? A. Force the client to take it. B. Document that the client was non-compliant. C. Ask the client why they are refusing the medication. D. Hide the medication in the client's food. Correct answer, C. Ask the client why they are refusing the medication. Rationale, the nurse should determine the reason for refusal and provide appropriate education. Clients have the right to participate in decisions about their care. Strategy, when a client refuses treatment, assess and educate before taking further action. Question 14. Which medication should the nurse question if prescribed for a client with a documented severe allergy to penicillin? A. Amoxicillin. B. Acetaminophen. C. Furosemide. D. Metformin. Correct answer, A. Amoxicillin. Rationale. Amoxicillin is a penicillin-class antibiotic and may cause an allergic reaction in a client with a severe penicillin allergy. Strategy, always check medication allergies before administration, especially when the medication belongs to the same drug class. Question 15. A nurse is administering a medication through a nasogastric tube. Which action is appropriate? A. Crush all medications together. B. Verify that the medication can be administered through the tube. C. Mix medications with enteral feeding automatically. D. Skip flushing the tube. Correct answer, B. Verify that the medication can be administered through the tube. Rationale, some medications should not be crushed or administered through feeding tubes because their effectiveness or safety may be altered. Strategy, check the formulation before crushing or administering medications through a tube. Question 16. A nurse accidentally drops an unopened tablet on the floor. What should the nurse do? A. Wipe the tablet and administer it. B. Return it to the medication drawer. C. Discard it and obtain a replacement. D. Give it to the client if it looks clean. Correct answer, C. Discard it and obtain a replacement. Rationale, a medication that falls on the floor is considered contaminated and should not be administered. Strategy, when medication contamination occurs, discard it and follow facility policy for replacement. Question 17. A nurse is administering a medication that can cause dizziness. Which instruction is most appropriate? A. Stand up quickly after taking the medication. B. Avoid getting out of bed without assistance if you feel dizzy. C. Stop drinking fluids. D. Take an extra dose if dizziness occurs. Correct answer, B. Avoid getting out of bed without assistance if you feel dizzy. Rationale, dizziness can increase the risk of falls and injury. Safety measures should be used until the medication's effects are known. Strategy, for medications causing dizziness, prioritize fall prevention. Question 18. A nurse is administering a medication and notices that the prescribed dose appears unusually high. What should the nurse do? A. Administer the dose because it was prescribed. B. Reduce the dose independently. C. Verify the prescription with the appropriate provider or pharmacist. D. Ask the client whether the dose seems correct. Correct answer, C. Verify the prescription with the appropriate provider or pharmacist. Rationale. An unusually high dose should be verified before administration to prevent a potentially dangerous medication error. Strategy, never independently change a prescribed dose. When something seems unsafe, stop and clarify. Question 19. Which medication should generally be taken at the same time each day to maintain consistent therapeutic levels? A. Antibiotic prescribed at regular intervals. B. Antacid taken as needed. C. Acetaminophen taken occasionally. D. Medication prescribed only for pain episodes. Correct answer, A. Antibiotic prescribed at regular intervals. Rationale, taking antibiotics at prescribed intervals helps maintain effective drug levels and promotes treatment effectiveness. Strategy, for scheduled medications, emphasize adherence to the prescribed timing and frequency. Question 20. A nurse is teaching a client about medication adherence. Which statement indicates understanding? A. I will stop the medication when I feel better. B. I will double the next dose if I forget one. C. I will take the medication exactly as prescribed. D. I can share my medication with family members. Correct answer, C. I will take the medication exactly as prescribed. Rationale: taking medications according to the prescribed dose and schedule promotes safety and effectiveness. Clients should not change doses or share medications. Strategy: choose statements that demonstrate correct adherence and safe medication practices. Question 21. A nurse is administering an oral liquid medication. Which action promotes accurate dosing? A. Estimate the amount using a household spoon. B. Use a calibrated medication device. C. Pour the medication directly into the client's mouth. D. Fill the cup above the prescribed amount. Correct answer, B. Use a calibrated medication device. Rationale: a calibrated medication device provides a more accurate dose than a household spoon. Accurate measurement helps prevent underdosing and overdosing. Strategy: for liquid medications, look for a calibrated device such as an oral syringe or medication cup. Question 22. A nurse is administering an intramuscular medication. Which finding should cause the nurse to reassess the selected injection site? A. The skin is intact. B. The muscle is appropriate for the medication. C. The site is bruised and inflamed. D. The client reports no pain. Correct answer, C. The site is bruised and inflamed. Rationale: bruised or inflamed tissue should generally be avoided for injections because absorption and tissue integrity may be affected. Strategy: select an injection site that is intact and free from inflammation, bruising, or injury. Question 23. A client taking a new medication develops difficulty breathing and swelling of the lips. What is the nurse's priority action? A. Give the next scheduled dose. B. Recognize the possibility of a severe allergic reaction and obtain emergency assistance. C. Encourage the client to drink water. D. Document the symptoms and reassess tomorrow. Correct answer, B. Recognize the possibility of a severe allergic reaction and obtain emergency assistance. Rationale: difficulty breathing and facial swelling can indicate a serious allergic reaction requiring immediate intervention. Airway and breathing are priorities. Strategy: use ABCs for life-threatening medication reactions. Airway and breathing problems require immediate attention. Question 24. A nurse is administering a medication that requires blood pressure monitoring. The client's blood pressure is significantly below the prescribed parameter. What should the nurse do? A. Administer the medication immediately. B. Hold the medication and follow the prescribed parameters. C. Double the dose. D. Ignore the blood pressure reading. Correct answer, B. Hold the medication and follow the prescribed parameters. Rationale: some medications can further lower blood pressure and may be unsafe when the client's blood pressure is already low. The nurse should follow the medication parameters and notify the appropriate provider when indicated. Strategy: when a medication has hold parameters, assess the vital sign first and follow the order. Question 25. A nurse is preparing to administer a medication and notices that the medication label is missing. What should the nurse do? A. Guess the medication based on its appearance. B. Administer it if another nurse recognizes it. C. Discard it according to policy and obtain a properly labeled medication. D. Ask the client if they recognize it. Correct answer, C. Discard it according to policy and obtain a properly labeled medication. Rationale: an unlabeled medication cannot be safely identified and should not be administered. Proper identification is essential to medication safety. Strategy: if you cannot positively identify a medication, do not administer it. Question 26. Which medication should the nurse question if prescribed to a client with a documented allergy to that medication? A. A medication from an unrelated class. B. The exact medication listed as an allergy. C. A prescribed vitamin. D. Normal saline. Correct answer, B. The exact medication listed as an allergy. Rationale: administering a medication to which the client has a documented allergy could cause a serious reaction. The prescription should be clarified before administration. Strategy: always compare the medication order with the client's allergy history. Question 27. A nurse is administering a medication and a client asks, "What is this medication for?" What is the best response? A. Just take it because the provider ordered it. B. I don't know. C. Explain the medication's purpose using information appropriate for the client. D. Tell the client to search online. Correct answer: C. Explain the medication's purpose using information appropriate for the client. Rationale: clients have the right to receive understandable information about their medications. Appropriate education promotes informed participation and adherence. Strategy: patient questions about medications are opportunities for education, not reasons to dismiss the client. Question 28. A nurse is administering several medications to the same client. Which action is safest? A. Give all medications without checking their compatibility. B. Verify each medication before administration. C. Mix all medications into one cup. D. Leave medications at the bedside. Correct answer: B. Verify each medication before administration. Rationale: each medication should be individually verified to ensure the correct drug, dose, route, and time. Mixing medications without verification can cause errors or incompatibilities. Strategy: multiple medications increase the risk of error, so careful verification is essential. Question 29. A nurse is administering a medication that requires the client to remain upright afterward. Which instruction is appropriate? A. Lie flat immediately after taking it. B. Remain upright as instructed after taking the medication. C. Skip the medication if you need to lie down. D. Take it only when you have pain. Correct answer: B. Remain upright as instructed after taking the medication. Rationale: remaining upright after certain medications helps reduce the risk of esophageal irritation or injury. Strategy: pay attention to route-specific and medication-specific administration instructions. Question 30. A nurse is reviewing a client's medication list and notices that two prescribed medications have similar names. What should the nurse do? A. Assume they are the same medication. B. Administer both without checking. C. Verify the medications carefully before administration. D. Ask the client to choose one. Correct answer: C. Verify the medications carefully before administration. Rationale: look-alike and sound-alike medication names can contribute to medication errors. The nurse should carefully verify the medication, dose, route, and indication. Strategy: similar medication names are a safety warning. Slow down and verify rather than relying on memory or appearance. Question 31. A nurse is preparing to administer a medication. Which action represents the right route of medication administration? A. Giving an oral medication intravenously. B. Giving an IM medication subcutaneously. C. Administering the medication by the route prescribed. D. Choosing the route that is easiest for the nurse. Correct answer: C. Administering the medication by the route prescribed. Rationale: the medication must be administered through the route ordered by the provider. Using the wrong route can cause serious harm. Strategy: always verify the medication route before administration. Question 32. A nurse is administering a medication and realizes that the client's name on the medication record does not match the client's identification band. What should the nurse do? A. Administer the medication anyway. B. Ask the roommate to identify the client. C. Stop and verify the client's identity. D. Change the name on the medication record. Correct answer: C. Stop and verify the client's identity. Rationale: a mismatch in identification creates a risk for a wrong patient medication error. The nurse should resolve the discrepancy before giving the medication. Strategy: never administer medication when patient identification is uncertain. Question 33. A client asks the nurse why a medication should be taken with food. Which response is best? A. All medications must be taken with food. B. Food may help reduce stomach irritation or affect how the medication is absorbed. C. You should always take twice the prescribed dose with food. D. It doesn't matter when you take it. Correct answer: B. Food may help reduce stomach irritation or affect how the medication is absorbed. Rationale. Some medications are taken with food to reduce gastrointestinal irritation or improve absorption. The nurse should explain medication-specific instructions. Strategy. Patient teaching should explain the reason behind important administration instructions. Question 34. A nurse is administering medication through N4 line. The client reports burning at the 4 site. What should the nurse do first? A. Continue administering the medication. B. Stop the medication and assess the 4 site. C. Increase the infusion rate. D. Apply pressure and continue the medication. Correct answer: B. Stop the medication and assess the 4 site. Rationale. Burning may indicate infiltration, irritation, or another 4 complication. The nurse should stop the medication and assess the site immediately. Strategy. When N4 client reports pain or burning, stop and assess before continuing. Question 35. Which action is appropriate when administering eye drops? A. Touch the dropper tip to the eye. B. Place the drops directly on the cornea. C. Avoid touching the dropper tip to the eye. D. Ask the client to blink repeatedly during administration. Correct answer: C. Avoid touching the dropper tip to the eye. Rationale. Touching the dropper to the eye can contaminate the medication and potentially injure the eye. Strategy. For eye medications, remember clean technique and no contact between the applicator and eye. Question 36. A nurse is administering ear drops to an adult client. How should the nurse position the client's ear? A. Pull the pinna down and forward. B. Pull the pinna up and back. C. Pull the pinna straight down. D. Do not manipulate the ear. Correct answer: B. Pull the pinna up and back. Rationale. For adults, the pinna is generally pulled up and back to straighten the ear canal during eardrop administration. Strategy. Remember, adult equals up and back, young child equals down and back. Question 37. A nurse is preparing a medication and notices that it has expired. What should the nurse do? A. Administer it if it looks normal. B. Administer half the dose. C. Do not administer it and obtain an appropriate replacement. D. Ask the client whether they want it. Correct answer: C. Do not administer it and obtain an appropriate replacement. Rationale. Expired medications should not be administered because their safety, potency, or effectiveness may be compromised. Strategy. Always check expiration dates before medication administration. Question 38. A nurse administers a medication that requires monitoring of serum drug levels. Which laboratory result should the nurse recognize as important? A. The client's hair color. B. The therapeutic drug level. C. The client's height. D. The client's room number. Correct answer: B. The therapeutic drug level. Rationale. Some medications have a narrow therapeutic range and require serum level monitoring to ensure effectiveness while preventing toxicity. Strategy. When a question mentions serum drug levels, think therapeutic range and toxicity. Question 39. A nurse is administering a medication that can cause sedation. Which instruction is most appropriate? A. Drive immediately after taking the medication. B. Avoid activities requiring alertness until you know how the medication affects you. C. Take an extra dose if you become sleepy. D. Drink alcohol to increase the medication's effect. Correct answer: B. Avoid activities requiring alertness until you know how the medication affects you. Rationale. Sedating medications can impair coordination and judgment, increasing the risk of accidents. Clients should use caution with driving and other activities requiring alertness. Strategy. For sedating medications, prioritize safety and fall or accident prevention. Question 40. A nurse is administering a medication that has a black box warning. What does this indicate? A. The medication is always harmless. B. The medication has an important serious safety warning. C. The medication does not require monitoring. D. The medication can be given without checking allergies. Correct answer, B. The medication has an important serious safety warning. Rationale: a boxed warning highlights serious or potentially life-threatening risks associated with a medication. Nurses must carefully follow safety precautions and monitoring requirements. Strategy: a boxed warning should immediately make you think serious safety risk. Question 41. A client taking a medication reports a mild headache. What should the nurse do? A. Immediately discontinue every medication. B. Assess the symptom and determine whether it may be medication-related. C. Tell the client to ignore it. D. Give an additional dose of the medication. Correct answer, B. Assess the symptom and determine whether it may be medication-related. Rationale: the nurse should assess new symptoms and determine whether they may represent an adverse effect. Further action depends on the severity and medication involved. Strategy: for new medication symptoms, assess first unless the client is experiencing an obvious emergency. Question 42. A nurse is preparing to administer a medication that has been stored improperly. What should the nurse do? A. Administer it immediately. B. Verify whether the medication remains safe to use. C. Give double the dose. D. Mix it with another medication. Correct answer, B. Verify whether the medication remains safe to use. Rationale: improper storage may affect medication stability and effectiveness. The nurse should follow pharmacy or facility guidance before administering it. Strategy: when storage conditions are questionable, do not assume the medication is safe. Question 43. A client asks the nurse, "Can I give my prescription medication to my spouse because they have the same symptoms?" What is the best response? A. Yes, if the symptoms are identical. B. Yes, but give half the dose. C. No. Prescription medications should not be shared. D. Only share it if your spouse has no allergies. Correct answer, C. No. Prescription medications should not be shared. Rationale: prescription medications are selected based on an individual's condition, history, allergies, and other factors. Sharing medications can cause serious harm. Strategy: never encourage medication sharing, even when symptoms appear similar. Question 44. A nurse is administering a medication that requires an apical pulse before administration. The client's pulse is below the prescribed parameter. What should the nurse do? A. Administer the medication. B. Hold the medication according to the order and notify the provider as indicated. C. Double the dose. D. Ignore the pulse rate. Correct answer, B. Hold the medication according to the order and notify the provider as indicated. Rationale: some medications can further decrease the heart rate. The nurse should follow the prescribed hold parameters and take appropriate action. Strategy: identify the required assessment before administration and compare the result with the medication's parameters. Question 45. A nurse is administering a medication to an older adult. Which factor is particularly important to consider? A. Older adults never experience medication side effects. B. Age-related changes can affect medication metabolism and elimination. C. Older adults always require higher doses. D. Medication allergies disappear with age. Correct answer, B. Age-related changes can affect medication metabolism and elimination. Rationale: age-related changes in kidney and liver function can affect how medications are processed and eliminated. This can increase the risk of adverse effects. Strategy: in older adults, think polypharmacy, altered metabolism, and increased risk of adverse effects. Question 46. A nurse is administering a medication and the client vomits immediately afterward. What should the nurse do? A. Automatically repeat the dose. B. Automatically double the next dose. C. Assess the situation and determine whether the medication was absorbed before giving another dose. D. Ignore the event. Correct answer, C. Assess the situation and determine whether the medication was absorbed before giving another dose. Rationale: repeating a medication without determining whether it was absorbed could result in an overdose. The nurse should assess and follow medication-specific guidance. Strategy: never automatically repeat a dose after vomiting. Determine what happened and seek appropriate guidance. Question 47. A nurse is preparing to administer a medication that requires reconstitution. What should the nurse do? A. Use any available liquid. B. Follow the manufacturer's or pharmacy's instructions. C. Add extra diluent to make administration easier. D. Guess the amount of diluent needed. Correct answer, B. Follow the manufacturer's or pharmacy's instructions. Rationale: reconstituted medications require the correct diluent and volume to achieve the prescribed concentration. Incorrect preparation can result in an inaccurate dose. Strategy: for reconstitution questions, carefully follow the specified diluent, volume, and concentration instructions. Question 48. A nurse is administering medication to a client who has difficulty understanding English. What is the best action? A. Ask a young child in the family to interpret. B. Speak louder. C. Use a qualified medical interpreter. D. Skip medication teaching. Correct answer, C. Use a qualified medical interpreter. Rationale: a qualified medical interpreter helps ensure accurate communication and informed medication administration. Family members, especially children, should not be relied upon for medical interpretation. Strategy: when language is a barrier, prioritize accurate communication through a qualified interpreter. Question 49. A nurse discovers that a client received the wrong medication. Which action should the nurse take after assessing the client? A. Hide the error. B. Follow facility policy for reporting the medication error. C. Alter the medication record. D. Blame another nurse. Correct answer, B. Follow facility policy for reporting the medication error. Rationale: medication errors must be reported according to facility policy so the client can receive appropriate follow-up and measures can be taken to prevent recurrence. Strategy: remember the sequence, protect and assess the client first, then report and document appropriately. Question 50. A nurse is preparing to administer a medication. Which combination correctly reflects important medication rights? A. Right patient, medication, dose, route, and time. B. Right room, bed, meal, and visitor. C. Right diagnosis, room, provider, and family. D. Right hospital, nurse, room, and diagnosis. Correct answer, A. Right patient, medication, dose, route, and time. Rationale: verifying the medication rights helps reduce medication errors and promotes safe administration. Nurses should also follow facility requirements for additional medication rights and safety checks. Strategy: before giving any medication, pause and verify the essential medication rights rather than relying on memory.